Hello everyone, my name is Ruth Valeria Tenker. I'm coming from Healthcare Communication Management, and then today I would like to present you about my thesis proposal entitled Analysis the Influence of Culture on the Role of Therapeutic Communication in Reducing Medical Errors of the Telemedicine in Indonesia. I hope you enjoy this video and then stay tuned for the next information that I will give you.
Indonesia have 17,000 islands with approximately 270,000 million populations. Although Indonesia have a lot of population, according to Minister of Health of Indonesia data in 2022, the ratio of doctors and patients in Indonesia is around 0.4 doctors per 1,000 population. This ratio is very small and put Indonesia in the third lowest doctors-patient ratio in Southeast Asia. Because of this ratio, Indonesia faces numerous challenges in providing equitable healthcare services across its geographically disparate. Riskesdas data 2018 found out that the 36% of the population said that it is difficult to get access to the hospital. The reasons are the duration to reach the hospital, transportation to the hospital, and the fees of the transportation to the hospital. This is, of course, a big challenge. Telemedicine comes as a solution because it can help overcome the challenges by enabling healthcare professionals to reach patients in remote areas, reducing travel burdens, and improving the efficiency of healthcare delivery. Indonesia is also known as a culturally rich country with diverse ethnic groups, languages, and belief systems. The cultural diversity poses unique challenges in healthcare, as cultural norms, values, and expectations can significantly influence communication patterns, attitudes toward healthcare, and patient-providers relationships. Healthcare and patient-provider relationship. Because of Indonesia rich in languages, medication errors is often undeniable. Medication error can result from various factors. 1. Communication breakdowns. 2. Lack of standardized processes. 3. Human factors. And 4. System vulnerabilities. Therapeutic communication is a crucial component of effective healthcare interaction. It involves the exchange of information, empathy, and understanding with the ultimate goal of improving patient outcomes, satisfaction, and overall well-being.
This research aims to address the following question. Number 1. How do cultural factors influence therapeutic communication in telemedicine in Indonesia? Second one, how do cultural factors impact the occurrence of the medical errors in telemedicine? Third, what strategies can be employed to enhance therapeutic communication in telemedicine, considering cultural nuances? Last, what recommendation can be proposed for the development of the culturally sensitive telemedicine practice to reduce medical errors in Indonesia? This research has 4 objectives. Number 1, to explore cultural factors that influence therapeutic communication in telemedicine in Indonesia. Number 2, to examine the impact of cultural factors on medical errors in telemedicine. Number 3, to identify strategies to enhance therapeutic communication in telemedicine considering cultural nuances. And the last, to propose recommendation for the development of the culturally sensitive telemedicine practice to reduce medical errors in Indonesia. This research will use some of the methodologies. With the paradigm, we will use social sciences, and the tradition we will use socio-cultural tradition, and the methodology we will use quantitative methodology with the correlative study. The first literature review that I want to talk about is the cross-cultural communication strategy in telemedicine, lesson from Indonesia. This study coming from Kurniawan and Ahadi in this year 2023. This article explores about the cross-cultural communication strategy in telemedicine, drawing insight from the Indonesian context. And it provides practical recommendation for healthcare provider. First, to enhance cultural sensitivity. Second, to adapt communication styles. And third, overcome cultural barriers in telemedicine interactions. The research from Wittich, Burkle, and Lanier 2014 talking about medication error, an overview for clinicians. This article found out that it has been estimated that medication errors cause 1 out of 131 outpatient deaths and 1 out of 854 inpatient deaths. Therefore, the factors that contributing to these medication errors including first, medication-related issues such as similar drug names. Second, patient-related factors including impaired cognitive function. Third one, or the last one, is the healthcare professional and patient-related factors. It is including the communication biases. And these communication biases happen because of the therapeutic communication is not good in implementations. In this theoretical framework, I'm using the grand theory of social penetration theory from Altman and Taylor, 1973. This theory focuses on the process of interpersonal communication and emphasizes the gradual and reciprocal self-disclosure between individuals as they develop closer relationships. Person-centered theory by Rogers, 1940, become my supporting theory in this research. According to the person-centered theory, therapeutic communication is based on 3 core conditions. Number 1 is empathy, number 2 is unconditional positive regard, and number 3 is congruence. Empathy involves the therapist's ability to understand and communicate an accurate understanding of the client's internal world, feelings, and experience. Unconditional positive regard refers to the therapist's acceptance and non-judgmental attitude toward the clients, providing a safe space for exploration and self-expression. While congruence implies that the therapist is genuine, transparent, and authentic in their interaction with the client, promoting trust and authenticity. That's all from my side, and then thank you so much for watching, and please help to give some feedbacks, and then please give some inputs for my further improvement. Thank you.